I'm Dr. Brandon Brown. I'm a pediatric and fetal radiologist, and I work at the Fetal Center at Riley Children's Health, and I've been practicing since 2008. I'm a pediatric radiologist, and I think that that role is especially important in the practice of medicine because there are so many things we can't see just looking at the patient, and radiology allows us to see beyond the surface. It allows us to look deeper and to understand more, and I get to work with all types of physicians all over the hospital of every pediatric specialty, and I really enjoy the way in which the practice of medicine comes together with technology and imaging to help us to understand what is ailing some of Indiana's most vulnerable children. When patients come to the Fetal Center, one of the services that we provide is advanced imaging, which can help us to understand exactly what's going on with a high-risk pregnancy, what threats might face both the mother and the baby. And so when patients come, they get their imaging and then they meet with me and we discuss what we see and what we don't see. We also discuss what to expect. A lot of the situations that we deal with are very serious and they're very alarming, and parents feel very uncertain about the future. And so we're able to sit down with them, talk about what we can understand based on the images we've obtained, and then we can help them to plan for what delivery and the immediate newborn period and even surgeries or treatments are going to look like down the road. And so I sit down with the families and I talk with them about the images themselves, but I also work with a team of surgeons and pediatricians and obstetricians to work and create a custom plan designed for each of the families that comes to see us. Pediatric radiology is a really terrific specialty to practice. My job is among the most diverse jobs I can imagine. I get to work with patients and families, children and parents. I get to see patients before they're born and then again after they're born. And I get to mix the care and comfort that physicians provide at the bedside with patients, also with the high technology and the cutting edge practice of imaging, whether it be CT scans or MRIs or ultrasound, where we can take the latest in advances in technology and apply it to the care that we want to provide on a personal basis to each patient. And I love that diverse mix. I love seeing patients, I love working with technology, I love assisting the other physicians in the hospital to do their jobs well. I think my work in a children's hospital is closely related to the fact that I enjoy growing things, all kinds of things. And so I spend a lot of my time outside of the hospital, out in my yard, gardening, working with my orchard, growing various fruit trees, and I get my whole family in on the project. We make apple cider and we make maple syrup, and we spend a lot of time outdoors, both caring for our yard and our environment where we live, but also in preparing food for our friends and loved ones.